Patients ask me all the time, what's better for pain relief, Panadol or Nurofen? Now, for decades, doctors have said things like, it's hard to tell, there's not much of a difference, it depends, but now it seems we've actually got a definitive answer. But before we get to that, it's important we clarify the question. Panadol is the brand name for a medication called paracetamol, or Americans might call it acetaminophen. It's got other brand names too, like Panamax, Heron, Tylenol, but at the end of the day, we're talking about the same actual medication, which is paracetamol. Nurofen is the brand name for a medication called ibuprofen. It's got other brand names too, like Brufen, Advil, but at the end of the day, it's the same stuff, ibuprofen. So what we really want to know is what's better for pain relief, ibuprofen or paracetamol? So let's look at the differences between the two. Imagine I bumped my elbow a few days ago and now it's bruised and hurting. So what's causing that pain? Well, what's causing the pain there is inflammation. So inflammation at the side of the elbow triggers the nerves there to send a pain signal up to my brain. Now, the way ibuprofen works is as an anti-inflammatory. So it tries to stop the inflammation happening at the elbow so it doesn't cause the release of chemicals that are eventually going to trigger the nerves here to fire a pain signal up to my brain. Paracetamol, on the other hand, works in a different way. It tries to work at the level off the brain, and it tries to dampen or reduce or modify the pain signals that the brain's already receiving. So the key difference there is ibuprofen is reducing inflammation at the site of where the problem is, so the pain signal is reduced from its source, whereas paracetamol is working by dampening the signals of pain that are already being received by the brain. So in theory, any conditions where pain is being caused by inflammation, ibuprofen is going to work better. So things like tonsillitis, bruises, middle ear infections. Paracetamol in these cases is not going to work as well. So the question is overall, what's better? So in any conditions where pain is being caused by inflammation, in theory, ibuprofen is going to work better. Things like tonsillitis, bruises, and middle ear infections. Paracetamol will still work, but theoretically not as well. So the question still is, for a variety of common conditions that cause pain, which is better? Sounds crazy to say, but until recently, we weren't actually sure. It's only a lot of recent analysis which has shown that for a variety of conditions that are common and cause pain, ibuprofen tends to outperform paracetamol. Now, this begs the question, why do we even suggest certain patients have paracetamol if we know ibuprofen's better? Well, for some people, ibuprofen might be the complete wrong choice. It's what we call is contraindicated because there's medical reasons why they should not have any. Other people might just be prone to the unpleasant side effects of ibuprofen, so we end up recommending paracetamol. But the great thing is that you can use paracetamol and ibuprofen together. There's good research showing that both these medications combined will offer better pain relief than just one of them. Also, generally speaking, they're quite safe to use together. It's worth mentioning I haven't gone into the side effects and the contraindications of either of these medications. There may be good reasons why you should not be having one or the other. These are the kind of things that have to be discussed in context of your personal medical history next time you see your GP.